Those people, which are most of you tuning in right now, have some type of pain, discomfort, inflammation, referred pain somewhere else in the body. But the bottom line is, here is something that I really think that can make a big difference. This is a brush. Most conditions that we're concerned about now are related to underneath the skull: occipital neuralgia, headaches, neck pain, decreased mobility, vertigo, ringing in the ears, tinnitus. And what we're going to do is we're going to stimulate those areas that can help heal not one, not two, but potentially all of those conditions. But we're going to use a brush. Now, this is not my brush, as you can see, but this brush, you must have bristles that are soft. You do not want hard bristles. We're going to stimulate the suboccipital area by just taking the brush behind the skull. If you look right here in this diagram, that's the area we want to stimulate. And we're going to take the bristles and we're just going to go back and forth underneath the skull. You hear pounding. Now, if you look what I'm doing here, just stimulating that area. You don't have to hit it too hard, but just keep stimulating it. I want you to do that for a good 45 seconds to a minute. After you do that, I want you to take the bristles. I want you just to brush that area, stimulate it right up underneath that skull, and do that for about 30 seconds or so. That's it. And you're saying, how can that help me? Called neurological bombardment, stimulating the brain, sending afferent messages to the brain sends efferent messages back to the muscle. There is such a major interconnection of nerve pathways that take place underneath the skull. I want you to try this. You have everything to gain and nothing to lose. People saying, wow, my eyes became easier to see. My equilibrium's better. I'm not hearing the ringing as much. I notice I can have more increased motion in my neck. I'm not having that spasming. I notice my anxiety eased up a little bit. I feel more relaxed. I slept better. These are possibilities that you can have by just stimulating that neurological bombardment underneath the skull, and I challenge every one of you out there.